Madame la ministre, sentez-vous à l'aise de parler en français si c'est mieux? On a de l'interprétation simultanée.
Parfait. Merci.
Good evening, everyone. My name is Alex Munter. I'm the CEO of the Canadian Medical Association, and I'm going to be your host for tonight's conversation with our new Federal Health Minister, the Honorable Marjorie Michel. We're delighted that she has joined us the first time she's participating in this kind of session. And I'm joined tonight as well by Dr. Margot Burnell from New Brunswick, who is the president of the CMA, and Dr. Jean-Joseph Condé from Quebec, who is a board member and Francophone spokesperson of the CMA. Needless to say, it has been quite a year in Canada and around the world. And we're dealing with a whole new deck of cards and issues that the federal government and provincial governments are dealing with. And this is a great opportunity tonight for us to engage with Minister Michel, to hear from her about her priorities and for her to hear from clinicians across Canada about your priorities. So just a couple of housekeeping matters. The session today will be in both official languages, and interpretation is available. There's a button on your screen, and the instructions are also in the chat. We are recording tonight's session, and we'll post it following the town hall for those unable to attend tonight. And at any time during the town hall, please add your question to the Q&A. You can upvote questions, and we'll try to get to as many of them as possible. J'aimerais commencer la séance comme on fait toujours à l'AMC en reconnaissant
So,
le
as we
territoire
always
où
do, we
on se
start off with a
situe.
land acknowledgement where we
I'm here
are.
in Ottawa, which is where the national headquarters of the CMA is located, and is on the never surrendered homeland of the Anishinaabe Algonquin Nation, a land of spirit and purity, of healing plants and sacred waters. And the Algonquin Anishinaabe people have been the stewards of this land since time immemorial. So we, with great humility, we offer gratitude for their commitment in keeping the song of a healthy nation alive for all people of this beautiful land. So this has been a busy year for the CMA, a federal election, a new government, and coming in a couple of weeks, 2 weeks, yes, the federal, provincial, and territorial health ministers will be meeting in Alberta to discuss common concerns. And as always, CMA will be there to represent you and to represent our aspirations for a stronger, better system. In a moment, we're going to hear from our president, Dr. Burnell, and then following that, hear from the minister. Without further ado, in the spirit of moving along, I'm now going to turn it over to Dr. Margot Burnell to open our session. Dr. Burnell.
Thank you, Alex. Good evening, everyone. Bonjour à tous et à tout le monde. And thanks to all of you for joining us tonight. It's an honor and a pleasure to have the Federal Health Minister, Marjorie Michel, with us, along with each and every one of you. Today, we're talking about solutions in healthcare, something that is of utmost importance to all of us. As a country, we've been through a lot this year, from a federal election to changes in leadership for economic threats from south of the border. And even beyond that, we know there are many urgent challenges that this government's facing: lowering the cost of living, making housing affordable again, and unifying our economy through nation-building projects, to name just a few. But we know that a strong country and a thriving economy cannot exist without a robust health system. Right now, many people in Canada are worried about getting health care when and where they need it. More than 6 million Canadians have no access to regular primary care and wait long times for surgeries and specialist care, well beyond the suggested benchmarks. We're also seeing more physicians burning out from long work hours, administrative burdens, and issues like the spread of health misinformation. It's no wonder that patients, citizens, and physicians are asking for change. I spent a lot of time traveling this country over the past few months in more than 50 meetings across the country, including with Minister Michel. Her leadership and dedication to the federal health file is incredibly encouraging. In particular, we've spoken about the CMA solutions to modernize healthcare and lay the groundwork for a more resilient and prosperous country. All of us at this town hall have seen how solutions can bring about greater access to care. How do we gain momentum for those solutions to take hold and momentum for change? Let's make sure physicians and all health professionals can practice where and when they are needed. Let's cut down on paperwork and drive digital innovation in the healthcare system. Let's work together to build the health workforce of the future with sound planning to make sure we meet the needs of our patients, be proactive, not reactive. We have a lot of work to do on reconciliation in healthcare to build on the apology to the Indigenous people a year ago. We must prioritize and advance Indigenous health and close gaps between how Indigenous and non-Indigenous people receive care. The Liberals promised many important initiatives to improve healthcare during the federal election, from adding thousands of new doctors to scaling up team-based care and enabling health professionals to work where and when they are needed. We are eager to see those solutions come to life. We know that takes time and teamwork. All of us on this call stand ready to support solutions that deliver better access to care. We look forward to working with government and all parties in Parliament to advance solutions to the health challenges ahead of us. We call on all of you to get involved as well. I encourage you to sign up to our advocacy mailing list using the link that will be emailed out following this event. That will ensure that we can keep you up to date on our work moving forward and share invitations to future events like this one. Let's get to work and create a better healthcare system for everyone together, create our future. I look forward to the discussion with the minister. Welcome. Thank you, merci, miigwech.
Thank you very much, Dr. Burnell. On va maintenant tourner la parole à la ministre
We'll now give the floor
Michel,
to Minister Michel,
nouvelle députée pour
new member
Papineau-Montréal,
for
nouvelle
Papineau
ministre de
in
Santé,
Montreal, new Minister
très
of Health,
expérimentée
but someone with a
dans le
lot of
domaine de la
experience
politique et de l'inclusion
in
sociale.
politics and social
Donc,
inclusion.
bienvenue, Madame la Ministre. C'est un
Welcome,
plaisir de vous
Minister.
revoir.
A great pleasure to see you again. Thank you very
Good
much.
evening, everyone. It's truly a privilege to join you for this important conversation. The Canadian Medical Association has been a strong and consistent voice for physicians and patients. Your advocacy has helped keep healthcare at the top of the national agenda. As Canada's Minister of Health, I see our work as a partnership and one that depends on strong leadership and shared commitment. With this in mind, I would like to congratulate Dr. Margot Burnell on her appointment as president of the Canadian Medical Association earlier this year. Dr. Burnell, your leadership comes at a pivotal time. I look forward to collaborating with you and your colleagues to continue build a stronger, more resilient health system for Canadians. That brings me to where I'd like to begin tonight, with the foundation of it all, healthcare itself. Healthcare is not just a cost to manage, it's an investment in growth. Lorsque les Canadiens et les Canadiennes sont en bonne
When
santé,
Canadians are
ils
healthy,
peuvent prendre soin de
they
leur
can
famille,
take care of their
contribuer
families,
à leur communauté
contribute to their
et bâtir
communities,
une économie
and
forte.
build a strong economy.
Ils peuvent contribuer à
They
un
can
Canada
contribute
fort.
to a stronger
Vous le
Canada.
constatez chaque jour dans
You've
votre
seen this
pratique.
for yourselves in your
Lorsque
practice.
les patients
When
reçoivent les soins
patients
dont ils ont
receive the
besoin,
care they need,
ils mènent une vie plus épanouie
they have a
et
more
contribuent pleinement à
rewarding
notre
life and
société.
they contribute more to our
De plus,
society.
le
In
secteur des
addition,
soins de santé
the healthcare
est l'un des
sector
secteurs économiques les
is one
plus
of the
dynamiques du
economic
Canada.
sectors which is the most dynamic in
En
Canada.
2024,
In
il
2024,
représentait
it represented
3,5 millions d'emplois,
3.5 million
soit
jobs,
15% de la population
15%
active du
of the
Canada.
working population in this country.
Every investment ultimately comes down to people. The patients, yes, but also the physicians, nurses, and health professionals on the front lines. While the supply of professionals is growing, demand is rising even faster. We need to make better use of the talent already here. Many internationally educated health professionals want to contribute, yet face long waits and complicated processes before they can practice. Actually, about a third of internationally educated health professionals that were employed were working in non-health occupations. We really need to do better. We've been talking about fixing credential recognition for years. We've been talking about fixing labor mobility. Together, let's do it. Now is the time. Dans 2 semaines, à Calgary,
In 2
je vais
weeks in
rencontrer mes
Calgary,
collègues
I'll
de
be meeting
province
with
et
my
territoire
provincial
pour
and
notre
territorial
réunion
colleagues
annuelle.
for our annual meeting.
J'espère sincèrement
I do
que nous
really
ferons
hope
des progrès
that
à
we
ce
will be able
sujet.
to make progress.
Mais déjà,
But
les
already,
discussions que nous avons eues cet
discussions
été
that
me
we've
donnent
had
beaucoup
over the
d'espoir.
summer give me a lot of hope.
Expanding access to care also means making sure the system is ready for the unexpected. Patients depend on reliable medicines, vaccines, and innovation. We are building domestic biomanufacturing so Canada can produce state-of-the-art vaccines, prepare for future health emergencies, and support Canadian research and jobs. Just last month, I was in Laval, Quebec, to celebrate the first domestically produced COVID-19 vaccine by Moderna. But we need more of that. We must make Canada more attractive and competitive for investment in new medicines and digital health innovations. And on this topic, I am working closely with my cabinet colleague, including Minister Joly and Minister Solomon. This is why we are modernizing regulations, cutting unnecessary red tape, improving transparency, and speeding up approvals. These investments protect patients, secure access to care, and reinforce healthcare as a pillar of both national resilience and long-term economic growth. We've talked about the people who power our health system. Almost as important are the tools and innovations that help them deliver care efficiently. One of the greatest opportunities is how we use health data and digital tools. Even if 95% of physicians now use electronic medical records, those records are often not connected to each other or the rest of the system. This creates barriers and unnecessary burden, especially in rural, remote, and indigenous communities. And quite often, it leads up to pile of paper accumulating in many of your offices. Je le sais parce que je l'ai vu de mes yeux à
I
Val
know
d'Or
this
cet
because
été.
I saw this in Val d'Or myself this
Nous devons
summer.
mettre la technologie au
We have
service
to
des
put
patients,
technology
améliorer leur vie,
to work
améliorer les
to
soins et
improve
construire
patients'
un
lives, to
système
improve
de
care,
santé
and to
prêt
build
pour
a
l'avenir.
healthcare
Parce
system which
que
is
les
ready for the
données sauvent
future,
des vies
because
et
data
améliorent la
saves lives and
productivité.
improves productivity.
Data saves lives, and by leveraging AI, we can make technology work for people, improving lives, improving care, and building a health system ready for the future. Before closing, there is one issue I would like to raise with this group. I traveled across the country this summer between Alberta, Nova Scotia, Manitoba, New Brunswick, Nunavut, and in my own province of Quebec, there was one issue that really came across: mental health. Mental health has been putting immense pressure on our healthcare system over the last few years. We have a mental health and addiction crisis here in Canada. There is no silver bullet to solve it, but we have to make things better. Through the integrated youth services, we are providing safe spaces, including culturally safe spaces for Indigenous youth, so they can exchange and receive early intervention supports. We are also working with provinces and territories, with community organizations, and with law enforcement authorities to address toxic drug crisis. This is paramount for the well-being of Canadians, but also to build Canada strong. Estimated cost tied to mental illness represent $60 billion annually in Canada only. We all need to work together: doctors, nurses, community organizations, provinces, territories, to address this issue. Les défis auxquels nous sommes confrontés,
The
qu'il
challenges
s'agisse de
we
renforcer
face,
les
be it
effectifs ou
strengthening
de moderniser les soins, ne
staffing
relèvent
or
pas
modernizing
uniquement des
care,
priorités
are not
fédérales ou
just federal
provinciales
or
ou même
provincial or
territoriales.
territorial
Ce sont des
priorities.
priorités
These are
communes
the
et
priorities that
les
we
progrès
share in
dépendent
common,
de
and
notre
progress
collaboration
depends on
à
us working
tous.
together.
J'aimerais finir en
I'd like to
remerciant
conclude
l'Association
by
médicale
thanking
canadienne
the
pour le travail
CMA
important qu'ils
for the
font auprès de
important
leurs
work
membres,
that you do
mais
with your
aussi
members, but
pour me
also
conseiller dans mon mandat.
to advise me
L'influence
in my
positive que
work.
vous
The
exercez
positive
sur notre
influence that you
système de
have
santé
on our
est
healthcare system
reconnue et
is
remarquée.
recognized and
Très
noticed.
ici. Merci, et maintenant je suis prête à répondre à vos questions.
And now I'm ready for any
Merci,
questions you may
Madame la
have.
Ministre. And
Thank you,
you're singing our
Minister.
tune. You say now is the time because there's, you know, you mentioned labor mobility. The first time the Canadian Medical Association ever called for ability for physicians to move across the country was 1880. So I think we've been thinking about it long enough in Canada, right? So we have a lot of questions. We're on fire, lots of questions. It's great. We did get folks that submitted questions in advance, so we'll start with those and see how many topics we can get covered. We'll do our best. So let me start actually with a video question sent in from Dr. Darren Martin, who's a family physician in Moncton, New Brunswick, and he met with Dr. Burnell, who's doing a nationwide. She may be following you around, Minister. She's doing a nationwide tour with for CMA. Can we see the video from Dr. Martin?
Les soins de santé primaires changent beaucoup à travers le
Primary
monde.
care are changing across the country, and I'm wondering what your vision is for the role of family physicians on these new teams.
Vous avez entendu et compris la question?
Did you hear and understand the question? Yes, the role of family medicine's GPs in the context of team practices, while the delivery of healthcare services is a provincial jurisdiction, territorial jurisdiction as well. However, I would say that access to primary care, family physicians is my first priority. And Canadians are complaining that they don't have access to physicians. And I think there's a model that I saw as I crisscrossed the country this summer, the model we call team-based care. So teams working together in cooperation. And I think that will bear fruit. It'll pay off. And this is why I'm continuing conversations with provinces and territories to encourage them to adopt this model. I think currently the crisis, the access crisis, is so serious that we must be open-minded to doing things differently. And we must use the best practices that work, and we must implement them across the country in various practices, because what's essential here is to have access to healthcare professionals. For patients, we have a shortage of physicians. We will increase the number of physicians. We're working on that now. However, we'll never have enough, given that the demand is continually growing. So this team-based care will provide support to patients, and I think that the association can help us here, can help us in working with Canadians so that Canadians really understand our open-mindedness and working to provide them with access to physicians. Dr. Condé. Thank you very much, Minister. I think that your vision is in line with that of the CMA. Family doctors, family physicians were the entry point to the healthcare system in the past. As you've said, today there's a shortage of physicians. Physicians are not the only entry point into the system. We have to open up to other professions. We have to work as a team with nurses, with physiotherapists, and also with mental health experts, psychologists, social workers, so that physicians are able to better serve their communities and to provide service to a larger number of patients. I think that your vision is the right one for the future of family medicine in Canada. Thank you, Doctor.
Next question. You mentioned many different priorities, and perhaps in shorter supply in Ottawa, even in shorter supply than money, is time in Parliament, time at Cabinet. And so I'm wondering, as you identify the top issues, what factors are helping you decide which ones are the most important to address and which ones are the most important to move forward?
Well, I would say first Canadians. Canadians first are complaining about access to care. So this is why it's my number one priority. And this is why I put a lot of effort working closely with my partners in provinces and territories to support them, looking at things differently, supporting them all the best I can, because this is a priority for Canadians. That's the priority number one. I would say also that I feel when I talk about access to care, we need to consider new tools like AI, who is coming in the field, very present in the field. It will help the system it will help people, doctors, health professionals, to save time. It will help access to care more efficiently. So I think this is why I'm working closely with Minister Joly, Minister Solomon, to see how we can better use those tools to support the healthcare system.
See. Next, we have another video question. CMA has a patient voice advisory group from coast to coast to coast. And so our questioner is Ambe Chinumu, who is a member of the patient voice advisory group from Yellowknife, Northwest Territories.
In northern and remote communities across Canada, people are struggling to access basic healthcare. While we have thousands of foreign-trained doctors that are willing and eager to contribute, what is your government doing to improve on healthcare in underserved areas and communities across Canada? And what are you doing to support and facilitate foreign-trained doctors to be able to work in Canada and contribute to our national healthcare system? Thank you.
So thank you for the question. Again, as you know, to access to new doctors in the system is the responsibility of provinces and colleges, I have to say. But, you know, as access to care is one of my top priority, and as to have more access to care, we need more doctors. And we have people in the country who already got trainings, who were doctors in their home country. What I am doing and what my government already did, we are funding provinces and territories. I think we gave $77 million to provinces and territories to support training for doctors, you know, those who studied abroad, to get in the system. And also we funded $86 million, I think, to 15 organizations across the country to support their access to the system. You know, it's difficult. It's very complicated because you have a lot of partners involved in that process, but you can assure that it's a conversation I am having with my partners in provinces and territories to push on that direction, because we are losing too much, you know, people who are eager to contribute to our system.
Dr. Condé?
Yes, if I can add, I'm working in a remote area in northern Quebec, and I am so conscious of the importance of having foreign graduates working with us. Actually, there's a small city, a 6,000 inhabitant city in Abitibi that today rely only on foreign graduate to provide healthcare. Even the pharmacist, the only pharmacist in the town is a foreign graduate. So we definitely need them. In the province of Saskatchewan, 50% of family docs are IMGs, but you're right. We have to work with immigration, because what they're telling me is that the challenge is really to get their permanent resident status. They come here with a temporary status, then they cannot take advantage of all the advantage Canada has to offer, as long as they are temporary. They're on a temporary basis. So if you could work with the immigration minister to help those foreign graduates get their permanent status more quickly, this would be very important for them, and this would help Canadians living in remote areas.
And Dr. Brunel, there's some good examples across Canada around this, right?
Yes, so Nova Scotia has a good program assessing international medical graduates. New Brunswick has also started that, and now we've started to see great returns on that investment, with expansion from family practice to subspecialty specialists and other allied health professionals. So that model will work.
So I think we are talking about two different things. One is the people who came in with their residency, but with their title of doctors in their home country, and they cannot get into the system, but they're already here. And we have also the second that Dr. Condé mentioned, are doctors coming abroad, accessing the system directly from their, international doctors. You need to know that I'm already working with my colleague in immigration, specifically not only for doctors, but for health professionals. So we are looking to see how we can build a fast track program. This is what I'm advocating for. And to do so, I'm working also closely with the provinces and territories to meet their needs. So I am on it, and I think we will see some result, I hope soon.
Very, very exciting. And the Nova Scotia program that Dr. Burnell mentioned is the regulator in Nova Scotia has actually set that up, and they're seeing patients. So it's a great model, and there are others across
Yes.
the country.
I think the challenge that Dr. Conde was raising, it's a number of those international doctors. They come as temporary foreign workers. They don't have the regular residency status, so it puts a lot of burden also on them. But this is what we are working on.
Bingo. Thank you. You mentioned, and I know it's a big priority for the Carney government, generally speaking, is interprovincial labor mobility. Over 90% of Canadian physicians would like to be able to have an interoperable license to be able to move between provinces to deliver care. What is that issue on your agenda to advance?
Again, yes, for sure, because as you could see in C5, we didn't put the health because of all the, because we need to work with provinces and territories to making sure that people can move from a province to another one. At the federal level, we are funding the National Registry of Physicians. This is one of the things we are doing. I know also that some provinces are signing MOU between themselves to to allow some health professionals to work from a province to another one. So I think we will see more and more. The more conversation we will have with provinces and territories, the better they will move in that direction to allow mobility, because I think the time is now. We cannot wait. We cannot have, I don't know how you said it in English, but une chasse gardée in every province. I don't want this person to go there.
You can't have
The whole
bailiwicks where
system
no one
is
can
at risk.
work.
So I think provinces and territories need the best they can, working together to see how they can improve. And I know in some provinces, for example, they sign agreement with another province who doesn't have the same expertise on something. So there's different ways to talk about mobility. I know also FEMRAC as a project to move with the federal model of physician licensure that I'm supporting. So I am putting all my weight as a federal minister to see if we can move in that direction. And I need to rely on you also, doctors, all the healthcare professionals to push in that direction.
Thank you. Sad news out of Alberta today, a death of a baby from measles, and 150 people or so in hospital in Alberta with measles, according to media reports. Completely preventable illness. And just wondering what the federal government's plans are to deal with the growing problem of false health information. I think we were pleased to see Health Canada put out some accurate information about Tylenol, for example, earlier this week. Nice to have a government in North America putting out accurate health information. Just wondering if this issue is on your radar and how you see addressing the issue of false health information.
Vaccination we know is key. The challenge we are facing and that you all are seeing since the pandemic, we see more and more, anti-science, new way of thinking, health coming from different groups. It's a challenging topic to deal with because we are doing all we can, like you said, we updated our site right away with the Tylenol. On vaccination, we have the vaccine ready to go. We are working with provinces. We talk to them, but the disinformation is so big, and where people are taking they are taking their news from, it's harder and harder for a federal government to reach directly to the people and to make sure that they believe what we are saying. And this is why I rely really on you, because you are on the ground. You know your population. You know who is more at risk of not trusting those kind of scientific tools like vaccines. So you are also our voice on the ground, because my role as the federal minister of health is making sure that we do campaign, we let people know that vaccinations save lives. The science showed it for years. But at the end of the day, we need to reach out to the people on the ground to make sure that they listen and understand how important it is to save their lives and the lives of their loved one. And this is what happened today. And it's really unfortunate. And I will take this opportunity to send my really deepest condolences to the family, because it's so hard to see this happening in 2025 in Canada.
It is indeed. Thank you. You mentioned digital health. You mentioned paper records. One of the really frustrating challenges for physicians, for clinicians, but also for patients is um, the the silos of information and the lack of interoperability between digital systems. And just wondering if you have a game plan. There was some progress in the previous parliament, but that ended with the election call. Can you give us an update on the digital interoperability issue?
Well, so it's one of my priorities to move this bill forward. I hope I will be able to do so very soon. I am already working with all partners, making sure that everyone is on board, so it can pass very rapidly, because it will change your work on the ground. I will thank Dr. Condé for the demonstration, the real demonstration he did for me in his office in Val d'Or, because it was really clear for me how this bill will improve the life of health professionals. And I would say also, while we are talking about AI, one of the things that will prevent us using AI at the level we can use it is the lack of, the same system sharing data, because of course, every province, every provider can use their own AI. But if we are looking to use AI at national level, we will need to share information, so it will be easier to get access to those tools.
Very good. Dr. Condé, the minister mentioned her visit to Val d'Or.
Oh, it was actually a great it was a great moment to be able to show her live the issues of physicians on the ground, how they have to deal with those that paperwork. So, Minister, if you can have this bill move forward, physicians, nurses, health professionals in the country are going to be very happy. It's going to improve our administrative burden, our quality of life, but also is going to make life easier for our patients, and it's going to be great for the system that will be able to to get the information very quickly and without having to open or to send a fax to get those medical information for our patients. So, and at the end of the day, probably the doctor will be able to see one or two patients more in his day because he doesn't have all that administrative burden. So the CMA definitely supports you on that.
So I would just add that the CMA does support that because it improves the patient-physician interaction. If you have all of that information and the patient can see their own information, then the ability to have a fulsome discussion about what their concern of the day is facilitates that. So that's critically important. You can spend your time dealing with that, not going looking for the information to give advice.
You can count on me. It's under my radar.
Excellent. During the recent election campaign, the Liberal Party platform included a commitment to invest in community healthcare infrastructure, pretty sizable amount. Going from memory, I want to say $4 billion, but you'll correct me if I got that wrong.
You got it.
I got it right. Okay, memory's still working. So, when will those checks start coming out? I guess the question should.
Well, it's a platform commitment. If it's a platform commitment, you need to understand that it's something that we would like to do because we sign as the Liberal Party, we sign on it. The challenge we are facing right now, it's the fact that in this uncertainty, it's impossible, I think, right now, tomorrow morning, to disburse those kind of, $4 billion. But the needs are there. And as you know, even health infrastructure is under provinces and territories, but the federal government committed to help on this. So as soon as we will have a window to do more, you can be assured that we will do so. But I would say for now, and I'm very pragmatic in what is happening right now, and I don't want to overpromise because we don't know what will happen tomorrow morning. You know it. Last week or 4 days ago we had 100% tariff. Now we don't, and it's always like things moving so fast that we have to be cautious. But it's still in play, and we know where the needs are. And I have to say, whenever this bucket of money would be available, the remote communities north are the first regions, I would say, where we would have to put some money in.
Very good. And you said when the window opens. So remember, we're always here to help you pry open windows. So next question from the audience, live question. How will the federal government ensure that federal transfers to provinces for health are used specifically as prescribed by the terms and conditions of that transfer agreement?
Well, it's already done, I would say. It's done in the sense that the last agreement that we signed with provinces and territories, they had to report back, and they are reporting. One of the challenge I feel we are having right now, and that I'm trying to fix also with their help, is how we can gather all information in the same framework, because everyone is sharing their data differently. And so I'm trying to harmonize how we can harmonize the collection of all those data. But I would tell you, they have to get the money, they have to report back. And it was part of, so I think as the healthcare system is under stress, people are saying maybe, well, but the federal government is giving a lot of money. But yes, true. But fair also, the provinces are putting a lot of money and don't get result and get the pressure on the ground. So I think this is why I say we have to look at things differently, see how we can work all together to improve the system with what we have in hands.
Very good. kind of a complicated long question, but I'll try to summarize. Is with respect to virtual care being excluded from reciprocal medical billing. Um, but much care, including a lot of you talked about mental health, a lot of mental health and addictions treatment is delivered virtually. And so the discontinuity there results to people falling off, falling out of the system with some very tragic outcomes sometimes. So, what steps can the federal government take to close the gap and ensure that patients on life-saving, particularly opioid treatment, can maintain uninterrupted access to care when they move between provinces? That's a detailed question, so if you need to take that one away.
Yes, well, as I know I think it's one of the topic I will raise in my meeting with provinces and territories, because I think again there we need to align ourselves and to see what are the irritants that make some provinces take that decision. And I have to tell you, particularly in this context, as the Minister of Health, my position is very clear. I am not there to fight with provinces because I'm trying to do better with our health system. I am open to work with every single province and territory to making sure that the federal government is supporting them by delivering better care to their population. This is very important because right now, in every single area, I think our role and your role also as leaders, we have to lower the temperature and see how we can work all together to give a better service to Canadians. Because right now we are all failing because the population doesn't feel supported.
Very good. Lots and lots and lots of questions. So, question about COVID, and concern from this questioner about the impact not only on the healthcare system, but many individuals, including children with long COVID, and impacts of long COVID on healthcare workers, causing staff shortages. So this is actually not a question. I'm just reading it. There's no question mark. Question, by the way, people has a question mark. But I guess more comment. We need to gain back control and implement COVID precautions immediately. So I think that was a comment to you, and maybe you can take that away. Question here, quoting our past president from Manitoba, Dr. Joss Reimer, who noted the opportunity that we have, given all of the turmoil in the United States, that we could gain a tremendous amount of medical and scientific expertise to Canada. You've mentioned this before, in the broader immigration context. What can we do to really take advantage of the opportunity to have talented clinicians and scientists from the United States who are looking for a better place to live and practice?
Well, I think Minister Joly, my colleague, is mentioning this all the time, that she is willing to bring I think 1,000 scientists in Canada, because we need to build, building Canada strong is also bringing new talent in. So I think Minister Joly has a strategy to reach out to those, scientists, those professionals, to create a path for them to come in Canada. But when they come in Canada, we have to be prepared, to invest in all those research. But it's on in Minister Joly's file, and she's on it. It's one of her priorities.
Merci. Question en français. C'est
Now a
quoi
question in French.
l'intention du gouvernement en tant que
What's the
gouvernement
government's
de financer des
intention
ressources
to
alternatives en
fund
énergie
alternative resources in intermediary
Les transferts aux provinces comprennent
uh,
toutes ces
care?
composantes-là.
Well, the transfers to the provinces already cover that. There's no additional program for that at the federal level. That's provincial jurisdiction. It really depends on the province you're talking about. It depends on all sorts of factors. Provinces have to make choices based on their population, the population they serve. There's no separate funding for that. Many questions.
Lots of questions about long COVID and particularly research into long COVID. So I don't know if that's on your radar, but that's certainly many of the participants today have concerns about that. All right. I'm just looking at the questions that have not yet been asked. Some countries have direct from high school MD and nursing programs, and these countries fund their students. Would modernizing the healthcare educational programs be part of addressing the lack of providers in our own country? It's great to have immigrant doctors, foreign training support us, but we also need to improve our healthcare education.
Well, I couldn't agree more. But again, it's on provinces and territories to prioritize, the training in the health sector. So I agree. We need to, for example, Dr. Conde was talking about social workers. Well, but we don't have enough social workers. If we had more social workers, they could help the clinician, with all this opioid crisis and mental health, because they are trained to, to support those kind of illness. So I think, yes, we would need to, and it's also a conversation I can have with my counterparts to encourage them to work with their education minister, because that's not on them, it's part of their national program, like in their province.
Thank you. Next question, is there a role for the federal government in encouraging prevention, exercise, diet, sleep, etc., to begin the process of empowering citizens to take a greater role in their own health and therefore to reduce the load on the current healthcare system?
For sure. I think at the federal level, we already have some program that, encourage people to have better, les meilleures habitudes de vie. Is it enough? Won't ever be enough. The thing is also how to reach out to those people. It's the same thing. How to get on the ground when you are the federal government, how to get on the ground. And now we are trying a lot of new things. We have social media, influencers. We need to look at things really differently from what we were doing before, on radio or on regular TV, because we have to go where people are. So this is what we are trying to do right now.
Thank you. Question from a family physician. Thank you, Minister Michel, for meeting with us. I am a family physician working with patients with many complex needs. I have found tremendous support from a nurse working with me in my practice. She relieves much burden from my work. However, there is no funding for this nurse and no structured training material. The program in British Columbia was temporary and was extremely difficult to meet requirements. Is the federal government going to fund expanding team-based care in family medicine to help support us?
No, as I said, we committed to provinces and territories right now to maintain the level of transfer that we are giving them, but it's on them to decide on how they want to work. Is it team-based care? Is it another way? Unfortunately, I can only encourage my counterparts to do so, but I am not going to have a special program because it's on their jurisdiction.
Okay.
But happy to raise it with BC.
All right.
You can count on me.
We are counting on you. Let's see, more questions on long COVID. So by the way, there's 51 questions. We're not expecting you to answer all 51, but what we will do is we'll send your office all of the questions so you have a sense of what's on what's on people's minds. You mentioned mental health. I have worked, here's the question. I have worked with the Mental Health Commission of Canada since its inception in 2007. The Mental Health Commission of Canada has become defunct as a catalyst for change. How do you intend to revive its mandate?
I would say I already met with the commission. I think in the short term, I am looking into it right now. I'm not moving with any big change for now because as I told you, I have to set, I have, I need to stay within my priorities. And my priorities are primary care, regulation, removing red tapes, mental health, youth mental health, men mental health, I would say, because it's like when you consider suicide and addiction, it's mostly men. So I would say, yes, we are, but Health Canada is working with the commission, but I'm not on the changes myself for now because I have to prioritize.
Very good. So I want to be respectful of your time, and time flies when you're having fun. Hopefully, you've been having fun. And we are coming to the end of our allotted time. So as promised, to everyone who presented a question, we will get all of your questions to the minister's office so that they're aware of what's on your mind. We'll also review them internally at CMA because it's very helpful for us. Dr. Burnell will be leading a delegation from the CMA to Calgary to the Health Ministers Conference there and meeting maybe with you again, Minister Michel, and certainly with provincial ministers too. So your feedback through the questions is very helpful to us as well. Dr. Condé, pour terminer, quelques réflexions.
Dr. Condé, would you like to conclude?
Merci, Alex.
Well, thank you very much, Alex. I'd like to thank everyone for joining us tonight, especially Federal Health Minister Marjorie Michel. We very much appreciated this opportunity to hear from you and to learn more about your vision for Canada's healthcare system. I'm especially heartened by your openness to work together with the CMA, with other key health leaders, and all major stakeholders in health, and of course, all levels of government on improving the healthcare system. We all know that there's a lot of work that remains to be done, but your positivity gives us great confidence. It was on show tonight, and it gives us great confidence in the road ahead. Now, of course, we must improve access to healthcare in this country. It's extremely important, not only for people here tonight at this town hall, but for every person who lives in Canada. People are counting on us because 89% of Canadians believe better healthcare is key to a stronger country and stronger resiliency. We also know that healthy Canadians are key to a thriving economy and a prosperous country. So we're very excited and look forward to working with you, Minister Michel, to make collective goals and the CMA's recommendations a reality. And for those of you who have joined us this evening for this town hall, if you wish to learn more about the solutions we've talked about tonight and during this webinar, please visit the Canadian Medical Association's website. And don't forget to sign up for our advocacy newsletter by using the instructions on the screen currently. We'll also email these instructions out to you after the event. Thank you.
Merci, Dr. Condé, and thank
you, Dr.
everyone.
Condé.
for your participation today. Most of all, thank you to the Minister for your time and for your openness to taking questions and for your very direct answers to the questions. Before people log off, we ask that you please complete a short poll that's about to come up onto your screen. And you'll get a longer evaluation after this session as well. So, merci, thank you, Miigwech. Good evening to everyone. Thank you for being here.
Merci beaucoup. À la prochaine.
À la prochaine.